Well, here is a look at our disarticulated skull, and we're going to concentrate in this video on describing the frontal bone and the parietal bone. So if we start with the frontal bone first, the frontal bone can be divided into two regions. You have the orbital region, or the orbital part, and the squamous part. The squamous part comes from the Latin word squama, which means scale. And when we look at this sagittal section through the skull, the squamous part, as you can see, is just a thin-walled curving plate that protects the front of the brain. It is the orbital part of the frontal bone that's going to be more interesting and have more features and details. So, for example, we're going to find that the orbital part, as the name suggests, is going to form part of the orbital wall, the superior part of the orbital wall. And the superior margin of the orbit, what is called the supraorbital margin, is indicated here. Don't think it's any more complicated than what it sounds like. Margin simply means edge, and supraorbital margin is simply the edge of the orbit, the border of the orbit. Then above the orbit, you're going to find either openings or notches. And these are going to be referred to as the supraorbital foramina or notches. Now, this is where you're going to see variability. Sometimes you're going to have foramina, which are openings within the bone, but sometimes the opening comes so close to the margin that it becomes a notch. And in some cases, you're going to find one or the other. You might even find one of each in the same skull, which has the anomalous frontal suture, by the way. We see that we have, on one side, we have what looks like a notch, and on the other side, we have a foramen. Another feature that you have that is not easily seen in this particular skull is a region that you call the glabella. The word glabella suggests hairless, and this is the part of the skull, or the part of the frontal bone above the nasal bone, between where you would have two eyebrows in the skin above, which is essentially hairless. So the word glabella implies this hairlessness. Then you have the superciliary arches. The superciliary arches are not easily seen in some skulls, particularly the feminine skulls. You can barely see it. It's kind of a pronounced line in the skull. But if we take a look at another skull, a masculine skull, we're going to more likely see a more pronounced superciliary arch. So here is a male skull where you can actually see the superciliary arch because it is more pronounced. Notice here that you have very distinct supraorbital notches in this specimen also. Here is another skull, and you can see the superciliary arches fairly well in this skull also. But also notice that in this skull, we don't have supraorbital notches. Instead, we have distinct supraorbital foramina. Another feature to note, which is kind of a subtle feature because it's a feature that you can more easily feel and see, is called the lacrimal fossa. It is a depression which is going to accommodate the lacrimal gland, which is located on the lateral side of the roof of the orbit. And again, if you can't see it, if you just stick your finger and feel, you'll notice that there is a depression in this location. Then one other feature to note, which you don't normally see, because in order to see it, you have to cut open the frontal bone, as is done here in this sagittal section through the skull. What you will see when you cut open the frontal bone and you look at the orbital part right underneath the glabella, what you'll find is what is called a sinus. And a sinus simply represents a space within the bone, an open space within the bone, we're going to see 4 bones that have sinuses, including the frontal bone. So one of the things that the frontal bone does have is a sinus, and again, unless you cut open the bone, you're not going to see this feature. Now we come to the very simple, easily dismissed parietal bone. It's a bone that forms most of the roof of the cranium, the wall of the cranium, and the word parietal means wall. And you'll see it in other places in anatomy. Whenever you see parietal, think wall, because that's what it means, a wall. If you'd like to take a quiz, you can go to the link below. And here is an image attribution. There's a link to this image below also.